Yeah.
Hello, everyone.
Hi, Corey. Nice to see you.
Yeah, I thought there was a
You will be sadly, I think you get automatically muted by Kritika. So you can write in the, yeah. We're waiting one more minute and the attendees are flowing in now.
Hello, Michael. Very nice that you are willing to give this presentation. It's much appreciated.
My pleasure.
Hey, so it just hit the 2 p.m. over here in Amsterdam and different times all over the world. So I think we can start now, and for sure people will keep dropping in. Michael, you could please change the slide. Thank you.
There you go, Isabel.
So, good afternoon, good morning, good evening to everyone that are all over the world here. And it's amazing to see how the attendee number is just increasing and increasing. And welcome to today's webinar that ISPO is organizing with the by the Scientific Committee for ISPO World Congress. And the title is How to Deliver a High Quality and Engaging Oral Presentations That People Will Remember. Because we believe this is highly important to get the skills in how to present, especially for conferences. But this is a skill I think you can bring with you to any types of presentation that you will have in the future. And this webinar will be held by Dr. Michael Dillon, which has a PhD, and he's a professor of prosthetics and orthotics at Trobe University, Australia. And he has published more than 80 peer-reviewed journal articles, which is very impressive, Michael. And he's experienced associate editor and former co-editor-in-chief of Prosthetics and Orthotics International. And thank you so much, Michael, for taking your time in holding this webinar for all of us. I'm very excited to learn new things today.
It's a pleasure, Isabella.
So we have some housekeeping rules here today for you all. So just so you know, this webinar will be recorded and will be uploaded on the ISPO Learn platform. And this will be uploaded there after this webinar. And ISPO members can see it. So if you're a member, you can go there later on if you want to remember some tips and tricks that Michael gave to you. If you're not a member, please become a member because that comes with the greatest discounts. You get access to the ISPO Learn platform and so on. And we will keep you all muted today. And we want you to use, please remember to use the chat in a friendly manner. Be kind to each other. And if there's something not working, maybe you can write it there. But any types of questions that you have to Michael, please write them in the Q&A. And you can see the Q&A. It's in the bottom badge of your screen, and it says Q&A with a question mark icon over, or two speaking bubbles illustrations over. And we are going to answer, or I'm going to read up the questions, and Michael is going to answer the questions in the end of his presentation, which is around 40 minutes long. And without further ado, I think it's time for Michael to take over the stage here. So good luck, Michael. And again, thank you so much. I see people are writing in the chat being excited for this.
Great. Thank you, Isabella. And welcome, everybody. I'd like to maybe start by thanking the Scientific Committee of the ISPO 2025 World Congress for the opportunity to present this webinar, but also the trust that they've shown, I guess, in me to being able to deliver this presentation. So when I was asked to deliver this presentation, maybe about 6 or 8 weeks ago, I've been spending a lot of time thinking about what makes a really great oral presentation. And I hope to have distilled those reflections into 7 key lessons. And over about the next 40 minutes or so, I'd like to touch on each of these lessons in turn. And then what I'm going to do is to try and bring it all together in a free paper presentation, as you might see at a ISPO World Congress. So whether you're a student doing your very first conference presentation, or you're a very seasoned presenter, I'm really glad to have you with us, and I hope that you get something really valuable out of the time we get to spend together. So let's get started. So the first of these lessons is really about the take-home message. And I think one of the biggest challenges in delivering a really effective presentation is to be absolutely clear about the purpose of your presentation and the take-home messages that you want to leave with your audience. Now, during the course of any piece of research or a thesis or a large project, you will have spent many years writing grants, ethics applications, analyzing data, writing and rewriting drafts of manuscripts, steering those through the process of peer review. And all of that work is really important to the success of any project, but it doesn't make for a very engaging or interesting oral presentation, and certainly not one that people are going to remember. So given that you can't present all the detail of a project in a short free paper presentation, I'm going to encourage you to think about your presentation maybe as a way to show people what you've done, or to tell people a little bit about what you've done. So for example, maybe your research project was designed to look at patient satisfaction with a new model of prosthetic and orthotic services. And maybe what you found is that patients were highly satisfied with the new model of service that you've created. And that's a really important take-home message that you want to leave with your audience. And I think sharing that message is really probably should be the purpose of your presentation. After all, it's the reason people came to see you present at the conference. And it's one of the things that I think most people hope to get out of coming to an ISPO conference. So being clear about the take-home message is also really important because your audience can only take on a small amount of information in a 7 or 8 minute free paper presentation. And for context, what you can cover in that time is probably not much more than what you would have written in your conference abstract. Now, if the purpose of your presentation is to tell people about how patient satisfaction improved with your new service, absolutely everything in your presentation needs to be tailored to communicating that message. So for example, if we look at the introduction of your presentation, that story needs to be absolutely focused on the problem of patient satisfaction, the problem that led you to do the piece of research in the first place. Maybe in the methods section, you'll present some key stages of the research process, but you're probably not going to be able to present a lot of detail for each of those. You won't be able to present all of your results, and I think you'll probably want to choose 1 or 2 illustrative examples. And in the discussion, you'll probably want to summarize your findings and explain what that means to a clinical audience. And I think if you can do all those things, you'll have done a good job of meeting the brief of the take-home message. So the second lesson that I wanted to share with you is about the importance of tailoring your message to a diverse professional audience. Now, attendees at an ISPO World Congress are all well-trained professionals. They're orthotists and prosthetists, they're rehab physicians, they're academics, they're engineers, they're physical therapists. They're knowledgeable about anatomy, orthotic and prosthetic interventions, treatment pathways. So they don't need you to cover a lot of the basic information for them. It can be an assumed level of knowledge given the professional audience that you'll be speaking to. But while they're a knowledgeable and professional audience, they're also a really diverse group of people. So they're diverse in terms of their professional background, but also the countries that people come from and the services that they work in. And I think there's a few things that are worth thinking about when you plan your presentation. So I think where you can, I would encourage you to avoid using jargon or colloquialisms that are common to your language, that they may not translate well to people coming from other countries or other cultures. Where you have important pieces of information, I think it's important that you take the time to explain those key concepts. So for example, if you are living in America or Uganda or the Netherlands, you may not know very much about the healthcare system in Australia. And if that detail is important to the purpose of your presentation, I think it's important that you take the time to explain that to people. And finally, all your presentations will probably have some technical details. It might be an engineering principle or a complex graph or a result. And I think in those cases, it's really important that you take the time to walk your audience through the detail of that graph or that concept. Because without doing that, your audience can't follow along and they miss the opportunity to learn, the very reason why they came to the conference presentation to begin with. So our third lesson is about time management. Now, in a 7 to 8 minute free paper presentation, the time that you have with your audience is really very limited. And because of that, it's going to be important that you can make the most of the time that you have available. And it's important that you can finish your presentation on time. When you go over time, it's not very courteous or very respectful to your audience or the other presenters in your session. Now, to make the most of the time that you have available with the audience, I have some do's and don'ts to share with you. I would encourage you to arrive early to wherever your presentation is being held and to have the session chair walk you through the AV equipment. You don't want to start your presentation fumbling around with the slides and not knowing how to advance the slides. It just wastes a lot of time and probably will make you quite anxious as well. I'd encourage you to know exactly what you want to say so that when you have the opportunity to connect with your audience, you're not just fumbling around with your words and not clear about the message that you want to leave them with. I'd encourage you to manage your time as you go. I think you don't want to get to the end of the time available and the session chair is telling you it's time to finish and you've still got 5 or 10 slides left to present. It's not a very good look for you as a professional, but you also miss the opportunity to share that important information if you haven't managed your time effectively. So the way I would encourage you to manage your time is to have specific checkpoints in your presentation. So for example, I might say that by the time I'm done the method section of my presentation, I want to be 3 minutes in to my 7-minute presentation time. I'd also suggest that you have a clear understanding about the content in your presentation that you can cut, or the presentation or the content that you can deliver more superficially if you're running short on time. And the last of the do's, I think, is to be well rehearsed. So I would take the opportunity to practice your presentation, make sure that it runs on time, and to have contingencies in case there are things like delays or setbacks that impose on the time that you have available. Now, for some of the don'ts, I would suggest that you don't, at the beginning of your presentation, spend the time reintroducing yourself and the title of your presentation if the session chair has just done that. There's no need to do it again. It's lovely to see beautiful pictures of the cities and institutions where delegates come from, but it's not a good use of your time in a 7 or 8 minute presentation. So please don't spend the time talking about your university or about how beautiful your home city is, unless that's absolutely relevant to the purpose and take-home message of your presentation. Right, so the fourth lesson that I'd like to leave with you this evening is about the slide content. And really well-designed slides can greatly enhance the effectiveness of your oral presentation. They can really help your audience follow along with your story, and they can affirm key messages that you want your audience to take home. But similarly, when it's done poorly, your slides can really detract from the clarity of the message and the effectiveness of your oral presentation. So let's look at some simple things that you can do to enhance your slides and help your audience get the most out of them. So one of the things I'd suggest in your slides is to use succinct text. And what I mean by that is to use bullet points So it's much easier to use bullet points than whole sentences. And I would encourage you to not use lengthy sentences. This second bullet point here is a really lengthy sentence. It's got complex punctuation, it's got a lot of words in it, and it makes it hard to quickly read, but it also makes it hard to figure out what the take-home message is. So where you can, avoid lengthy sentences. For the size of the auditoriums that most of you will be speaking at, you probably want a minimum font size of 24-point font. Anything smaller gets too difficult to read on a presentation. It might look great on the high resolution monitor in your office or in your home, but it probably won't work well in a venue for 50 or 100 or 200 people. So please pay attention to the minimum font size. I'd also encourage you to choose fonts that are simple, that are clear, and that they contrast with the background. So in this example, we've got a nice dark black font on a white background, which will really help that font stand out and make it easy for people to read. I think it's important that the words that you put on your slide match the words that you say. And I think when you can match the words you say with the words on your slides, it really helps the audience follow along, and they can easily match what you're telling them with where we're at on a particular slide presentation. Now, I don't mean for a minute that you should write everything on your slide and read it verbatim. That's not interesting. It's not easy to listen to. But I think mirroring the words that you say on the slides can be helpful for everybody. Animations can be a really effective way to help your audience focus on the right parts of your slides at the right time. So animations like the ones that I'm using here can be appear. So text or icons can just simply appear. And we can also make them simply disappear, or they can be grayed out, like the other examples on this page. That helps people focus on the point that I want to make, which is here about using animations. So animating your slides can be a great way to help your audience focus on where we're at any given point in time. Now, the final point that I want to leave you with about the slide content is what I've called signposting. And signposting is a really important way to help guide your audience through your presentation. So in a traditional research presentation, signposting is pretty easy because people understand that we have an introduction section and a method section and a results section and a discussion section and a conclusion. So each of those headings are effectively a form of signposting, and in a well-trodden format like the introduction, methods, results, and discussions, that's all you need to help your audience follow along. But when your presentation gets more complicated or is more unusual like this one, I think it's helpful to have an overview at the very beginning of your presentation, and then to match the title of each slide with that overview. And hopefully I've been able to do that effectively in this presentation by matching the colors and the numbers and the words on each individual slide with the slide at the beginning that had all the different parts of the presentation that we were going to cover today. Now, it's also possible that you can use your oral presentation, the words that you say, to also help signpost for your reader or your audience where we're at. So for example, I might get to the end of my presentation and use something and say something like, in conclusion, let me reiterate what we've covered. that phrase, in conclusion, is a form of signposting, but it's not relying on the slide content alone to guide the audience or remind the audience where we're at. All right. So the next lesson that I'd like to talk about is using tables. And in my view, tables make it really difficult to convey the take-home message to an audience effectively. And in my view, there are much, much better options than to use tables in most presentations. So let's have a look at an example. So this table actually comes from a recent journal article that we published. And the table actually describes the demographics of participants in this particular study. And it includes information about their sex and age, their qualifications, the years since they've been certified to work as prosthetists or orthotists, and the discipline that they practice in. Now, the trouble with this sort of format is that the text is often too small to read in an auditorium. You might be able to read it on your presentation at home on a good, clean monitor, but they're hard to read in an auditorium where the AV isn't quite so good. There's often a lot of information in a table, and that information isn't presented in a way that makes it quick and easy to navigate or to make sense of. In my view, the tables set up like this are not very interesting to look at. They certainly don't keep my attention in the same way that pictures do. And I think that the information isn't well curated to capture the take-home message that I want my audience to know about the participants in this study. Now, you've probably seen versions of tables where people do things like explode or expand particular parts of the table, or to highlight parts of a table. And that can be helpful. It certainly draws your attention to the particular thing that the presenter's talking about, and making it bigger can make it easier to read. But it doesn't solve some of the problems, like the information isn't well curated to communicate the take-home message, and it's still not a very interesting or engaging format to look at. So, as I said at the beginning, I think there's lots of alternatives to presenting tables that are much more interesting and easy to read and understand. So, for example, this example here presents all the same information that was in the table, but does it using simple infographics. So the infographics are things like a symbol for male sex, or a picture of a qualification, which talks about the certification. And these sorts of simple infographics can be very effective when they're paired with simple descriptive statistics, like percentages or averages. Now, in this example, I hope that you can see it's much easier to work out that about half the participants in this study were male, they were middle-aged, they'd had many years of clinical experience, 80% of them were certified to work as prosthetists and orthotists, and that on average people spent about 3/4 of their workday doing clinical work. So I hope that you agree this would be a much more interesting and engaging way to present that sort of information than trying to do it in a table. Right. So the sixth lesson that I'd like to talk through is about figures. And in my view, figures are an excellent way to convey the take-home message really effectively. And it's why you'll see figures used in almost all of the presentations at conferences. But figures are most effective when they're simple. So where you can, make sure that your figures are as simple as possible. It can be helpful if you curate the information in your figures to the take-home message you want to leave your audience with. And it's also important that when you present the figures, that you take the time to orient your audience to the figure and then to walk them through the detail. So I'm going to try and do all of this in the next slide, where we'll actually look at a figure. So this figure actually comes from an editorial by Professor David Armstrong. And in this editorial, Professor Armstrong tries to make the case, or does make the case, that the outcomes after diabetic foot complications are often similar to cancer. So let me orient you to this figure as I might in a presentation at a conference. So this figure describes the 5-year mortality rate of different cancers and different diabetic foot complications. On the vertical axis, we have the proportion of people who died within 5 years of their diagnosis. And on the horizontal axis, we have different kinds of cancers and different kinds of diabetic foot complications. From example, breast cancer to Charcot foot to a diabetic foot ulcer, all the way through to lung cancer at the other end of this figure. Now, these data are organized in a way that's designed to show how increasing rates of mortality differ between different cancers and with different diabetic foot complications. And it's easy to see how the mortality rate is quite low with some cancers like breast cancer, whereas the rate of mortality is quite high with some diabetic foot complications like major amputation. So given the way these data are presented, it's easy to see that the mortality increases with maybe more severe forms of cancer or more complex diabetic foot complications. Now, given the way these data are presented, it can be really hard to quickly and easily work out how cancer, the rates of mortality after cancer would compare to diabetic foot complications. And if that was something that was important to the take-home message, I think you can reorganize the data in a way that's more effective. So this is exactly the same data as was used to build the last slide. The only difference here is that we've organized the data to group together all cancers and all diabetic foot complications. And in synthesizing the data in that way, I think we've made it much easier to compare the 5-year mortality rate with all cancers and all diabetic foot complications. So just like the last graph, the vertical axis has the proportion of people who died within 5 years of their diagnosis. And what you can see here is that about 30% of people will have died within 5 years of a cancer diagnosis, and about 45% of people will have died within 5 years of a diabetic foot complication. So by organizing the data in this way, I think it makes the side-by-side comparison much easier for your audience to understand, but it also gives you some new insights that we couldn't see in the previous version. So, for example, this makes it much easier to see that diabetic foot, at about 50% more people will die within 5 years of a diabetic foot complication compared to a cancer diagnosis. And that's a really important take-home message, and one that wasn't easy to see in the previous slide version. All right, so the final lesson that I'd like to leave you with this evening is about an engaging oral presentation. So I think an engaging oral presentation is absolutely key to communicating your take-home message effectively. And I think these are some of the tips that I'd like to share for how you can do that most effectively. So I would encourage each of you to back yourself. Often with particularly inexperienced presenters, people often doubt whether they should be on the podium, whether they know their work well enough. And I would say that if you've spent 1, 2, 3, 5 years working on a project, I would argue that you are probably the best expert in the room on your project. You will know that work inside and out and better than anyone else in the room. And I think that you can have confidence that the scientific committee have also reviewed your abstract and considered it suitable for presentation at a conference. So I think you can step onto that podium in good confidence, knowing that you have every right to be there and that you're a topic expert. In my view, the best presentations at a conference are those that feel like a genuine or authentic conversation with an audience. And I think the ones that resonate most with me feel like when I get to talk to a researcher or a clinician about their work over a cup of coffee. And if you can approach your presentation in that sort of very candid manner, I think it's much easier for your audience to connect with you, but also to follow along with the story that you have to share. And that connection gets really hard when you read the notes from your presentation. When you read a presentation, your voice changes. You lose the intonation and inflection in your voice that makes it very difficult for an audience to listen to you. So where you can, I'd encourage you to absolutely avoid reading your presentation. Now, if your presentation has been thoughtfully prepared, you've been clear about the take-home message, you've taken the time to design your slides carefully, and you're well rehearsed, you shouldn't have any problems with timing. And if that's the case, I'd encourage you to enjoy the experience if you can. Take the time, make sure that you present your work slowly in a way that other people can understand. And that's going to require you to be well prepared. So make sure you practice and get feedback from other people as you go. So I hope that you've found value in one or more of those 7 simple lessons for how to deliver an effective oral presentation. But what I'd like to do at this stage is to try and bring it all together for you in a way that you might expect at a conference presentation. And what I'm going to do is spend just a few minutes and I'm going to deliver you a mock presentation, a pretend presentation. And hopefully I can weave all these 7 lessons in to this presentation. And as I'm delivering the presentation, I'm going to ask you to think about what you think works really well and what you think you would like to do differently if you had the opportunity. So let's jump in. So this was a piece of work that we finished last year, and we published it earlier this year. And this piece of work is looking at the barriers and facilitators that influence the use of telehealth among orthotists and prosthetists in the United States. So contemporary telehealth research is focused on the experience of orthotic and prosthetic users. And what we know from recent research is that all sorts of prosthetic and orthotic care is being provided by telehealth, from initial assessments all the way through to fittings and follow-ups. And we know that the majority of O&P users are really very satisfied with the use of telehealth, and they're also highly satisfied with the service that they receive through telehealth. So the question that we had was, if there are all these benefits to O&P users, why don't more clinical facilities use telehealth to deliver O&P care? And given that question, we had the following research aim, which was to explore the orthotists and prosthetists' perspective of the barriers and facilitators influencing the use of telehealth. And we undertook this study in the USA, given the population size, made it much more feasible than to do this work in Australia. So in this study, we recruited orthotic and prosthetic clinicians from right across the United States. We did one-on-one semi-structured interviews with those clinicians, and the interviews included questions to learn more about their demographics, like their sex and age. We asked questions to learn more about the practice setting that they work in, like public or private practice. We asked them questions to learn more about their clinical experience and their experience with telehealth. And we also had a range of questions to probe at their thoughts about the barriers and facilitators of using telehealth. Now, each of those interviews were transcribed verbatim. They were coded by two different researchers, and those two researchers met regularly to talk about their different perspectives about the interviews that they had just coded. We then brought those codes together to develop themes and sub-themes, which became the results for this work. Now, in this study, we recruited 30 participants from across the United States, and these participants were equally split between men and women. They were typically middle-aged. They had many years of clinical experience, and they worked as both prosthetists and orthotists most of the time. Clinicians spent about 3/4 of their time providing clinical care, and most clinicians saw both adult and pediatric patients. 2/3 of them worked in public hospitals as opposed to private clinics. Now, there are many results that we could talk about in this study, but for the sake of the time available, we're going to just talk briefly about 3. So what we learned, one of the things that we learned in this study was that there were 3 things that everybody needed to be able to participate in telehealth. So everyone needed access to a reliable phone or internet reception. And it didn't matter if you were in a rural area or a major hospital. This was a challenge for everybody. We hadn't appreciated the extent to which people needed access to a telephone or a smartphone or a computer with a webcam. And there were populations of orthotic and prosthetic users that just didn't have access to that sort of technology. Even if people had access to the technology and reliable phone and internet reception, they also had to have the capability to be able to use it themselves or support from a spouse or a partner or a family member who could help them resolve the technical challenges like their microphone isn't working. And only once those 3 things were in place, people were able to participate in telehealth. In this study, we also saw that a variety of different telehealth modes were being used across the spectrum of orthotic and prosthetic care. So most commonly, video conferencing was used, and video conferencing was used almost exclusively for initial patient meetings, like an initial assessment, or for a scheduled review, like a regular follow-up. Unscheduled reviews were those that a patient initiated, and usually because there was a problem, like the device caused a blister or was uncomfortable. And in those cases, what we saw is that patients tended to call a clinical service or send a text message, or they sent an email. And in those cases, clinicians would try and resolve those issues via phone or email. And where they couldn't, they would then schedule a video conference to learn more and to be able to diagnose and treat the problem that the person presented with. And we also saw occasions where consumables like stump socks were sent out to patients via courier or post. And we also saw occasions where prosthetic and orthotic devices were sent to people via courier, and then they were fitted in a follow-up video conference. Interviews also highlighted some of the things that people did that really made telehealth successful. Patients hated getting cold calls from a facility when they weren't expecting them. Clinicians found it much easier to manage their time and to manage the different modes when appointments of the same kind were blocked together. So all the telehealth sessions were put together, or all the in-person sessions were put together, but trying not to mix them up. Many of the facilities had organised assistants who would jump on a video call early, and they would try and resolve many of the technical issues that people had. And facilities that did a good job of this also provided patients with really clear instructions about the purpose of the telehealth consult and how they needed to set themselves up at home to make the most of the appointment. So in discussion, what we saw in our research is that telehealth is being used across the entire spectrum of orthotic and prosthetic care. Once the absolute essentials are in place, like a reliable phone and internet service, facilities could make a really outstanding telehealth experience by following some best practice examples, like grouping appointments of the same mode together, or providing patients with really clear instructions about how they could effectively do telehealth at home. And we think there's opportunities to share this sort of information more broadly across the profession in the education we provide to both undergraduate students, but also to trained professionals through forums like conferences. And if you'd like to know more about this work, you can look at the publication that we've produced, and the QR code here will allow you to access that. All right, so I'm done now with my mock free paper presentation. I hope that in the process you've had an opportunity to see how those 7 lessons might all come together in a conference presentation like the one that you might give in the weeks ahead. And I hope that you found something useful in that. So at this stage, I want to close out the formal part of today's webinar by just reminding people of the things we've covered today. So we've spoken briefly about the importance of the take-home message and being clear about the purpose of your presentation. We've spoken about how you might tailor your message to meet a diverse audience of ISPO attendees. We've spoken about the importance of managing your time, making sure that the slide content can really support your oral presentation, some of the difficulties using tables to effectively communicate your message and how they can be much more effectively done using figures, and also the importance of having an engaging oral delivery where you can authentically connect with your audience as opposed to reading your presentation. So I'm going to leave it there and hand back over to Isabella, who's, I think, is going to chair the Q&A part of the session.
Yes. Thank you so much, Michael, for this. And I took lots of notes, so I hope that you all took some notes to take home those tips and tricks. A great presentation. So here I have a list of questions and I will click on them so they get answered live. So let's see. Which softwares would you use so that you can create these good presentations as you are doing right now?
That's a great question. So this presentation was built using Microsoft PowerPoint. And I was deliberate in using that piece of software, I think, because most people have access to it. So there's nothing very special that we've done. But I think there are some, simple things you can do to help. So one is, if you want to think about how you can organize the information, there are lots of great ideas if you do a Google search. So for example, I knew that I wanted to talk about 7 lessons. I didn't know how I was going to build a slide with 7 different bits in it. So I looked up on Google slide template for 7 things. And I got this lovely sort of flower image. And all I did was copy it and put it in my presentation. Lots of the pictures you can also find if you do a Google search for icons. So if you type in like patient icon or hospital icon or quality of life icon, you'll get these lovely black and white line drawings. And again, you can easily cut and paste those into a presentation and lay them out here. So I think we haven't used anything complicated, but I hope those extra tips can be helpful.
But I saw that your icons changed color. So are those icons from PowerPoint, so you could change their color, or were those from some other place?
Yeah, so once they're in PowerPoint, you can select them and you can then gray them out as a feature in PowerPoint. Yep.
And what font were you using, I wonder?
The font in this presentation is called Roboto, R-O-B-O-T-O. It's a standard font, and I quite like it in that it's not very complicated. So it doesn't have lots of fancy curls, or it's just plain and simple, which makes it easy to read.
Thank you. Then they wonder if they have a slide where there are words and there are figure. Is there any recommendation if you should have the figure on the left side or the right side and the text? Do you have any preference for that?
Nope, I don't. I think if you can, I would avoid having text and figures together. You know, if the purpose of the slide is to talk about the figure or the results, I would focus on the figure. I'd make it big enough that people can read it and look at it. But if you have to have both, I think the only suggestion I would have is that most people will read a slide from left to right.
Mm-hmm.
The first thing that you would need to talk about is the figure, and then the text. I would put the figure on the left because that's where people will start reading.
So then I think there was a confusion here because a person asked, should the organizer present my abstract on the screen as it's submitted? But I think you meant that you should keep the content of the presentation to similar content of the abstract to not have too much content of the presentation, if I'm not wrong.
That's right. I'm sorry if that wasn't clear. Yeah. The point I was trying to make is in a 7-minute presentation, you can only communicate a small amount of information. And for context, what's written in your abstract is about the level of information that you can communicate effectively in a 7 or 8-minute conference presentation. Mm-hmm. So by the time you introduce yourself or orient people to a figure and explain what it means, all of that takes time. So I hope that clarifies.
Thank you. Then if you're only allowed to have one slide, so you have a pitch, for example, the 3-minute thesis competition, or you have a 1 minute to do one slide, 1-minute pitch for one slide, what type of content should you then have on one slide?
Oh, that's a really difficult question, Isabella. In the 3-minute thesis presentations that I get to see every year, I think the most effective of those are places where people use pictures, largely pictures with no words. And if their presentation has like 3 messages in the 3 minutes, that they might have like 3 parts of a slide, one sort of on each part of the message. But that might be 3 pictures or three things that link together with an arrow, like in a circle or something. But I think not a lot of words. I think a picture, and if you can choose your pictures so that they're meaningful for the story, I think that's about as good as I can.
That's a good tip. I will apply that when I have my 3-minute presentation. So here they're asking, is there a rough number of minutes to number of slides? Because we hear that there should be 1 minute, like 1 slide per minute. Do you have any recommendations for that?
Look, I think the 1 slide per minute is probably a good rule of thumb, but I think it depends on how complicated the information is on your slide. So, for example, if we look at the mock presentation that I gave, the aim slide, which had the 1-sentence statement of the aim, that slide probably took 20 seconds to deliver, whereas some of the results slides probably took 1.5 minutes to deliver.
True.
So I think it's not a bad guide, but I wouldn't get hung up on the absolute number. I think your best guide is to practice, rehearse, and add or cut slides accordingly.
So maybe it's more about what's the maximum time you should stay on a slide to not maybe lose the focus of the audience. Like if you maybe stay on a slide for 2 minutes, we lose the interest of the audience then, for example.
Yeah, I think it depends a lot on what's on the slide and what the message is. You know, if you were presenting a meta-analysis, you know, that could take you a couple of minutes to do a good job of orienting an audience to that and presenting it. But I think if you're able to, you know, step through each of the parts one at a time and take the audience with you, I think it can be much more meaningful than if you just splash it up and tell people what the answer is and people are still trying to get oriented to it.
Yeah. So a person here wonders, how did you learn to speak so calmly as you do while presenting? Was it practice, learning from other presenters, combination? Can you maybe give any recommendation for people that speak too fast, how they can learn to speak as calmly as you do?
It's a really good question. So I still get nervous presenting at conferences, and I do find it hard in conferences to manage my nerves. I think over time I've got better at making sure that the content allows me to speak slowly and clearly. But I think I've also become more comfortable with the idea that you know, I've done this work, and a scientific committee think it's worthy of presentation, and that you know, I can stand on a podium proudly given the work that I've done, and that helps me not be so anxious about it. And if I think about it, I used to worry that I'd say the wrong thing, or I used to worry that someone in the audience would disagree. I think on the whole, we're very lucky that our community is very generous. And I think the best presentations, as I said, sound more like having a cup of coffee with somebody than a rehearsed script. So I think just back yourself and just see your audience as a group of colleagues or friends, and they're all there to support each other, I think, on the whole.
You are a very good presenter. It's very easy to follow you when you speak because it's very calm and good.
Thank you.
And
I've also had lots of practice.
If I can bring in a little tip, I went to a presentation workshop a month ago, and they taught us to clap between each sentence, and it might feel silly in the start. So I would say a sentence, then clap, say a sentence, then clap, just to actually get the feeling of how long it feels like it's very long, that pause, but it's not actually for the listener, for the audience. So that can be a practical
Correct.
tip in the start when you practice your presentation. We have 4 more minutes here, and I will take let me see some more questions before we start closing it up with some last information. So sometimes the auditorium screen is very wide and does not match the screen on your laptop. How do you resolve that? Is it settings in PowerPoint or?
Yep. So when I prepared this presentation, like I do with all conference presentations, I looked at the instructions for authors, and the instructions for authors for the ISPO 2025 conference ask authors to prepare their slides using a 16:9 aspect ratio. And that's a setting that you can choose in PowerPoint. So it's a wide screen setting. So the slide fills the whole screen, and then you don't get those big black bars on the side, which you'll get if you use the narrow screen format. So my advice is choose the slide format, like the aspect ratio, to match what the conference organizer tells you. They will have received that guidance from the audiovisual team who's running the conference. And as a presenter, I think you just want to make sure you comply with those instructions. It'll give you the best chance of having the right format for that particular venue.
Thank you. I hope that answered your question to the person that submitted it. And I will take a last question now. How can I reproduce graphical information in my presentation in a better way other than a graph? So how can you present a graph in another way than a graph?
It's a hard question. I'd probably need more context to answer that well. I think maybe the place I would start is I would think about, well, what is the purpose of sharing that graph with a conference audience? So what's the take-home message that I want that audience to leave with by looking at that graph? Now, and then I would think about, well, what's the best way to communicate that take-home message? And the answer to that question will tell you what your slide should look like. So, for example, this isn't a graph version, but you'll remember in the mock presentation that I gave, we had one slide with 3 circles where we talked about clinicians needed 3 absolute essentials to participate in telehealth. Now, that information in its original form is actually in quotes, like first-person quotes. They're written, 3 or 4 sentences of text each. So I could have built that slide using 3 or 4 bubbles with 3 or 4 sentences in each, and that would have conveyed the same take-home message. The problem is it's too hard to read.
True.
So I think thinking about, well, what's the take-home message? And these are these 3 things people need, and then finding a format that best suits that.
So thank you, Michael, for having answered all those questions. There were more questions, but we don't have the time to answer that now. So before we close this session, we have some more information to share with you all. And I hope everyone that asked their question was also happy with the answer. So once we're done with this webinar, you will receive a certificate of attendance for this webinar. And that's after you have completed a survey, which will be emailed to you. And then we have a next slide. We really want to remind you for the ISP World Congress, we have a fika, which in Swedish means when you eat some cookies and drink coffee and get together for all the early career professionals. And that's on the first day of the conference in the morning, so before the conference starts. And we would love you to join us so that you can meet each other and meet with the peers from all over the world and enjoy the fika. And you will get to know lots of people and maybe new friends that you can have good connections with during the conference, but also after. Then, next slide, if we have one. So remember, please, I hope that you will all come so we get to see you. And I really want to thank you so much, Michael, again, for this amazing webinar. I took lots of notes and the people in the chat are complimenting you a lot, saying that this was very helpful, that this was great. So thank you, Michael, and thank you all that joined this. And I hope to see you all in June in Stockholm.
Thank you, everyone. Have a good day. Bye for now.
Have a good day, evening, morning.